Just seeing my little brother in prison, he was like my best friend. And unfortunately, he passed away a couple years ago. But yeah, just seeing him behind bars, I was like, man, I don't want to live like this. I
Yeah.
can't keep, going down the same path. So I think probably when I saw him, that's probably an inflection point for me. I was like, man, I got to straighten up and make sure I get out of Shreveport.
Today, we're going to be speaking with one of the most inspiring individuals I've come across on the internet. His name is Dr. Antonio Webb. He was born and raised in Shreveport, Louisiana, a city with a crime rate that is 144% higher than the national average. He saw his friends, his brother, and his sister go in and out of prison. His mother, addicted to drugs, also in and out of prison several times throughout his childhood, became paralyzed from the waist down after being shot. This was life as he knew it growing up. But he changed the trajectory of his life when he joined the military at age 17. Since then, he went on to become an LPN, or licensed practical nurse, to pursuing his dreams of becoming an orthopedic surgeon. He is now a practicing orthopedic surgeon in San Antonio, Texas, an author, a motivational speaker, and he has a YouTube channel with over 380,000 subscribers where he shares his experiences as an orthopedic surgeon, and he sprinkles in a few financial videos for his viewers that are interested in finance. So with that said, Dr. Webb, let us know where you're from and why you decided to become an orthopedic surgeon.
Yeah, so my name is Dr. Antonio Webb. I am an orthopedic spine surgeon here in San Antonio, Texas. My path really started kind of in the military to medicine when I went in at the age of 17 and did 8 years in the U.S. Air Force with the whole goal of getting out of the military and going to medical school. So I knew going in that I was going to become a physician. And I was a medic as well as a LVN, and that's kind of how I started my journey to medicine.
And why did you become an LVN in the first place? What was the reasoning behind that?
Yeah, so the LVN, it's as a medic in the military, specifically the Air Force, the Army also, uh, our training is very similar to a LVN. So we were able to challenge the California Board of Nursing to become an LVN. So the training, very similar. And I just basically challenged the California Board of Vocational Nursing and got my LVN that way.
And how long did you work as an LVN?
I worked probably 2 or 3 years as an LVN. I was a medic for 8 years in the military, but specifically 2 or 3 years I worked in the ICU, surgical ICU mostly.
That's interesting. What state was this in?
San Antonio, Texas.
Ah. And why did you end up in San Antonio, Texas?
That's kind of where the military sent me. Yeah, that was basically my duty station, and I really spent my entire military career in San Antonio. I had orders to Korea, but I was able to kind of turn those down and stay in school because I was going to school full time in the military too. So I would work as a medic at nighttime at the ICU, pediatric ICU, let's say from 6 p.m. to like 6 a.m., like 12-hour shifts. And then I would get off of work and go to school maybe from 7 to 12, maybe 1 o'clock. And I would sleep for a couple hours and then go back to work. So I did that for, man, a long time, a couple years. And
Wow.
it took me 7 years to get my undergraduate degree, but finally finished it. It was hard trying to juggle military and going to school full time.
And how old were you when you got your LVN license?
I had to be maybe 20 years
Wow.
old.
You're
Yeah.
pretty young.
Yeah.
Well, okay, so you practiced as an LVN for a couple of years, and then what did you do, or how did you decide to get into medical school or go into medical school?
Well, I knew going into the military, I went in at age 17. I knew I was going to become a physician ever since a magnet program in high school that I got exposed to. I just wanted to become a physician. But becoming a LVN, it was like a stepping stone to becoming a physician. And going into medical school, I was somewhat familiar with a lot of the terminology, the medications, and just the language that's used in medicine. So it was somewhat helpful to me to just be familiar with those terms. And anyone else that wants to become a physician, just having a nursing background can certainly help.
But you grew up in one of the most dangerous neighborhoods in the US. What was it that led you to want to become a physician when you were surrounded with all this crime around you? What made you different from your siblings? What was it?
Yeah, I mean that's interesting question. I get that a lot, and honestly, not sure. I think it was really a magnet program. I mean, I would credit that program that just sparked an interest or gave me the insight of, wow, this is something that's possible. And I had a best friend. We kind of stuck together. He's a cardiothoracic anesthesiologist. And basically, we just hung out with each other and looked out for each other and just tried to make the right decisions. And I'm not saying I made all the right decisions, certainly got into a lot of trouble and was heading down the wrong path a couple times. And, I basically just stayed in the books. But you are right. A lot of my family members, friends, my little sister did time in prison. My little brother was sentenced to a juvenile life sentence for armed robbery. My mom, ever since I've been young, she's been on and off drugs and in and out of jail my whole life. And just a few years ago, she was actually shot and she's paralyzed from her waist down due to her drug addiction. And also my dad, when he was young, he was joined a gang, sold drugs, used drugs. I mean, he just tells me all the stories of the things that he was doing, like breaking in people's houses when they were at home, getting shot by the cops or getting shot at. I think there was a time where a bullet just barely missed his ankle when he was running from them. So they were shooting at him. Yeah, my dad was a G back in the day. Luckily, I mean, he turned his life around. He became a minister. He was a pastor at one point. And, we would go out into the streets of Shreveport, Louisiana, and just minister. And we would hand out pamphlets, hand out food. And just, he's a really giving person. And I saw that growing up and just kind of took note of that.
So I guess you seeing him turn his life around probably made you think, maybe I can do something better for my own life. Like I can probably change my own course of life after seeing what your father did.
Yeah, just seeing that same thing over and over again. I mean, people in and out of jail, people getting killed. I've had so many friends that I've lost. My cousin that I grew up with, kind of growing up in Shreveport, Louisiana, I mean, he did time in prison, recently got out maybe about 2 years ago. And just seeing him kind of fall victim to that path, I mean, that was hard. Just seeing my little brother in prison, he was like my best friend. And unfortunately, he passed away a couple years ago. But yeah, just seeing him behind bars, I was like, man, I don't want to live like this.
Yeah.
Can't keep, going down the same path. So I think when I saw him, that's probably an inflection point for me. I was like, man, I got to straighten up and make sure I get out of Shreveport. And that's really was kind of my impetus for joining the military as well, just to get out of that environment. I left at age 17. They let me graduate high school early because we were kind of on the quarter system. I had completed all my credits. So in December of my senior year of high school, I went to boot camp and I came back to walk with my graduating class in my military uniform around May of graduation. So, but I'm glad I got out of Shreveport. If I would have stayed there, I would probably be dead or in jail right now.
Wow. How's your relationship with your mother at this point?
It's good as it can be.
Yeah.
So she's has a lot of medical conditions and I try to do as much as I can.
Gotcha. So, okay, walk us through your course of when you got into medical school to the point where you became an orthopedic surgeon. How long did that take? What was the route that you took to get there?
Yeah, so medical school, as everyone knows, is 4 years, and then you have to apply for residency. For surgery, or especially for orthopedic surgery, I mean, that's really competitive. I applied to about 80 programs.
Wow.
As a medical student and interviewed, man, probably 14, 15 places.
Jeez.
And then so you have to complete a orthopedic surgery residency. It's 5 years. And then you have to, most people do a fellowship. I did a fellowship in spine surgery, so I did an additional year. But I really don't even talk about kind of the extra years in college that it took me. So it took me actually 7 years of college. I did a 1 year post-bac program as well, just basically to strengthen my application. So that's 8, 4 years in medical school. So that's 16, 5 years of surgical residency. That's 21. Hey, I'm
Oh, man, you're going to keep going, huh?
yeah, so I don't know. I lose track of the time. I can't even count. I mean, it took a long time.
Why orthopedic surgery?
Um, orthopedic surgery, I really love it. It's a really collegial field. It's, man, I love the reconstructive part of it. Patient comes in with a really bad fracture and the pieces are kind of all smashed in 10 different pieces. It's like putting together a puzzle sometimes. You have to like really, okay, this piece goes here. You're going to put a screw in this and put a large plate or external fixator, which is all these pins and wires to just reconstruct things. And I just kind of fell in love with the reconstructive aspect of it. And you can do so many things in orthopedics. You can do knee replacements, hip replacements. You can do foot and ankle, ACL repairs, slap tears, rotator cuff, spine surgery. I mean, the list kind of goes on, and that's what I really enjoyed about it.
I got to tell you, I ran across your video on how much student loan debt you had, which was over $500,000. And
Mhm.
I subscribed to you ever since then because you said your goal was to like pay that off in a couple of years.
Yeah.
But I've been following you ever since, and I've been so obsessed with your orthopedic videos. Like, I'm not even into, medicine like that, but your videos are so interesting. There's one of your videos that has like 16 million views, like chiropractors performing like a procedure on their patients where they like pull on their heads,
Yeah, the
try
Y
to like what's
yeah,
it called?
it's called the Y strap.
There you go.
Strap at death.
Yeah, right. Yeah, but you do sprinkle in some financial videos in between, which I find really interesting because you've been posting videos on YouTube for about 9 years now,
Oh,
right?
really? Yeah.
Yeah.
Right.
And one of your most recent videos, this I think you posted it about 2, 3 months ago or so, where you purchased the property and your goal was to hold it as a rental property. It was a home that you purchased recently. I don't know if you actually went through with the purchase,
Yeah.
but I know that you also are trying to invest your money. You're not just spending your money, all the money that you make from your practice, because now you also have a practice.
Yeah.
Right. So, what is your financial goal? Because I know as surgeons, you guys make like four, 500, $600,000 plus per year. So,
Yes.
what is your financial goal with the income that you make? Do you plan to invest it in any way?
Yeah, absolutely. So that's the problem that a lot of physicians face. They outlive their lifestyle, or they try to keep up with with the Joneses. And it's okay to have nice things. I mean, I have nice things, but also you really have to be responsible and forward thinking and thinking about your finances and investing. Because I don't plan to practice medicine forever. My hands could be injured. I have insurance on my hands. So if something happens to my hands and I
Wow.
can't operate, certainly there's income to replace that, but it's not going to be at the same level as kind of what we earn as surgeons. But when I'm talking about investing and also finances, I think it's really important that you have to diversify. So you shouldn't put all your eggs in one basket. So there's pre-tax investment opportunities, there's post-tax investment, like a brokerage account or like index funds, which I invest in pretty heavily, and then you have your real estate, and especially as a surgeon in Texas, there's other ancillary opportunities, invest in hospitals and surgery centers, buildings, commercial real estate. So there's a lot of opportunities to do that, but diversification is key.
And why did you decide to open up your own practice?
Well, I'm in a practice with a large group of doctors, so
Gotcha.
we're all considered kind of independent.
Yeah.
But I've always had that entrepreneurial mindset, and I'm a business person, so I
Yeah.
love business. So in terms of just making my own decisions, in terms of how I practice medicine and where I want to practice medicine, who I want to hire, who I want to work for me, I wanted those decisions to be made by me and not by someone that's in the corporate world, like a big hospital or a academic center. So when you go out into medicine, there's three different pathways, really the three different main ones. You can work for a hospital as an employed physician and they pay you a salary. The second option is to work at an academic center where you teach residents, medical students, you become professor, assistant professor, and all that other crap. The other one is private practice, which I'm in. So and that's when you're independent physician. And most people in private practice, they get paid 1099. So those are the three main practice models.
Gotcha. And I saw you posted a video during COVID where, elective surgeries were being shut down and all these other things were happening that were affecting your practice. How is your practice doing now? Are you guys much more profitable now than you were during COVID?
Yeah, absolutely. We did take a large hit. Most people lost quite a bit of money during COVID. There's some people that actually benefited from it as well, but the vast majority of people took a pretty significant hit. So, but practice is going well. I have a really busy and robust practice. My surgical calendar is kind of booked out until like October, November at this point.
Wow.
I have two nurse practitioners that work for me. My plan is to hire a third one in January timeframe. And this past week, I did about 10 surgeries. The week before that, I did 13. So I do. My practice is very busy. We see about 60 patients in a full clinic day. Just me and
Jeez.
my two nurse practitioners. So, but yeah, staying busy.
Now, how do you manage all of this? Because you also run a YouTube channel and you have various other things that you're running at the same time. How do you do all of this?
Well, you have to be really disciplined. And that comes from my time in the military. Whatever field that you're in, if you're a nurse, lawyer, whatever business person, you have to be disciplined. And I have a really rigid schedule. And the first thing to do is really just wake up early. I mean, I never sleep in. I don't even know how to sleep in. My internal alarm clock goes off every morning at 4:15, 4:30, and I just get up. I really don't even need my alarm clock. I come straight to my office. I usually, get some work done, watch the news, look at the tickers for the stock market, and uh, and just try to accomplish as much as I can before the day gets started. And then 2 days a week, I train. I have a trainer. Just started that a couple weeks ago, and so we train at 5:30 to 6:30, and I go straight to surgery from there. But it's been really disciplined with your time, making checklists of everything that you need to accomplish during that day. And the people that survive, especially in private practice, where you eat what you kill, is really the model. If I take off work, I don't get paid, but I have nurse practitioners that are still working, get to earn some income that way. But it's not like I'm an employee at the hospital where I have a guaranteed salary. No, if I take off for 2 weeks, that I'm going out overseas here in a few days, or actually tomorrow, I don't get paid. So if you work at an academic center, you get paid time off. So there's a lot of pros and cons to the different practice models, but you have to be very disciplined. And the people that succeed in private practice are ones that are extremely efficient with your time. And I would say on a scale of 1 to 10, with someone who's very efficient, I'm probably a 15. I'm like OCD about it. Like,
Yeah.
I complete all of my notes for the week and all of my operative reports. I have templates and everything is kind of to the T. I mean, I run a machine. That's really the only way to really do it and be successful in private practice.
I mean, you must be having racing thoughts through your mind all day, every day.
I'm always thinking about something I got to do. Yeah, but
Yeah.
also I have a family too, though. So I have 3 kids.
Yeah.
Um,
Yeah.
yeah, I got to spend time with them and make sure my wife, some quality time with her too. So,
Exactly.
but I'm usually, I try to get all of my surgeries done and clinic notes and everything before I go home, and just spend a few hours with my family once I do get home.
Yeah. So on average, how many hours a week you work?
I don't know. As a resident, sometimes up to 80 to 100 hours a week.
Mm.
As a fellow, a little bit less than that. But in practice, if I have to give a wild guess, maybe 60.
Yeah.
But the time actually working at the hospital and in my office, that does not count all the other time that I'm prepared for surgeries, reading, talking to other physicians, just game planning particular complex surgery. So, I mean, it adds up probably 60 to 80
Wow.
and all the
Wait,
other too.
do you ever feel stressed with the amount of work that you have to do?
No, not really stress. I mean, sometimes it can be overwhelming, but
Mm.
this is what we train for. So,
True.
uh, as I mentioned, for to become a spine surgeon, I mean, it takes 15 years of training just to get to
Yeah.
this point. So, everything is for me. It's really routine in the operating room. There's some patients that do have some aberrant anatomy and things that kind of throw you off a little bit, and you have to really think on your feet. And a lot of times, I've been in a case like, man, I've never seen this before, never done this. You have to really just go back to your knowledge, people that have taught you, and just really just take a second, just think about what you're trying to achieve. But not really stress. It's just that's what we plan for. That's same thing in the military, in the combat situation. Maybe that's stressful. Some people, you have to be really resilient.
So you mentioned earlier that you have to insure your hands. I had no idea, and I didn't think about that. That you as
Yeah,
a surgeon actually do have to do something like that.
yeah. Just like singers, they insure their voices.
Wow.
Some people have $1 million policies on their hands.
Yeah.
Something happens to my hands, I can't operate. Yeah, you got to have an insurance policy on your hands.
I saw one of the videos that you made. You reacted to an anesthesiologist who made like $70,000 a month, right?
Yeah,
And I love your reaction videos because you've also reacted to videos on Dave Ramsey's show where I
yeah.
think one of the callers had over $400,000 in student loan debts. Where do you think you stand at the moment with your student loans? Do you still have the goals of paying those student loans off in a couple of years, or take your time, or maybe get them dismissed? What's the goal with the student loans?
Well, I go kind of ebbs and flows, especially with this 0% pause.
Yeah.
It's, I think from a financial standpoint, investment standpoint, it's better to put that money elsewhere and let it work for you, especially when it's 0%. So, I mean, I recently made a $100,000 payment to my student loans, and probably next week I'll make another $150,000 payment,
Wow.
and hopefully within the next 6 months, probably less than that, I'll pay it off.
You got to update us, man. You got to put this on a YouTube video.
Yeah, I will. Yeah, just
I'm
man.
telling you. So I watch your videos. I follow you on Instagram. Can you let my viewers know how to reach out to you if they want to see your videos, they want to get in contact with your content?
Yeah, most of my content's Antonio Webb MD. That's LinkedIn. Instagram is Dr Antonio Webb MD. My other Instagram was hacked. Couldn't get it back and I had to start over, but that's okay. YouTube, Antonio Webb MD, TikTok, Twitter. Yeah, that's how you can find me. My website is AntonioWebbMD as well.com.
Yeah. And you also have a book. What's the name of your book?
Book is called Overcoming the Odds, and wrote that a couple years ago, really to inspire a kid that looks like me, that comes from a similar background, that they can just pick up and have some actionable items throughout the book, mistakes that I've made along the way to get to this point, and just wanted to kind of chronicle my life story of growing up in Louisiana and becoming a spine surgeon.
All right, guys, that's it for today. If you enjoyed this video and you want to see more like it, then make sure you let us know in the comment section below, like this video, and follow us for more.